What is the UK's coronavirus exit strategy? The number of new infections is said to be stabilising. Hospital admissions in London in particular are down, but nearly 900 more people in hospitals have now lost their lives.
What's important now, as we're a few weeks further on, is actually getting the real number as to infections in the community, and that is best done by testing antibodies, i.e. testing people who have developed or caught the virus and then developed an immune response and have got antibodies in their blood.
But the World Health Organization warns the science is complex. And remember all the talk of herd immunity.
There's been an expectation maybe that herd immunity may have been achieved and that the majority of people in society may already have developed antibodies. I think the general evidence is pointing against that and pointing towards a much lower seroprevalence, so it may not solve the problem that governments are trying to solve.
Low seroprevalence might mean limited immunity, but we won't really know for a year or so.
One of the problems is that we just don't have people who have had COVID-19 and recovered for a long period. I mean, even if you went back to the patients who were infected right at the very beginning, so late December last year, we'll only have responses from a few people that might last 5 months. And actually, it won't be until Christmas and actually spring next year that we'll be able to go back to all the people who've been infected in this first wave and ask whether they're still protected.
What it seems like so far is that people that are very unwell produce a good antibody response, a high level of antibodies to the virus, but we also see quite a range of response, particularly those, again, that have a more mild infection. So we don't really know what that means yet, and we don't know how long the antibodies will last as a person then goes back to their normal everyday life, whether they will last years or months.
Although human vaccine trials have now begun, we are still months, if not a year or more, away from mass production. And there's still much we don't know about the virus itself. How quickly might the current strain mutate?
It doesn't actually mutate that fast. It mutates more slowly than, for example, influenza. And that gives us some confidence that it's not going to be mutating into perhaps a new strain that might need a new immune response very quickly.
But what is the UK's exit strategy when testing rates are still so low? The government's almost certain to miss its target of 100,000 tests a day by the end of the month, and we're still testing far fewer than other countries. So if the government is going to ease the lockdown, how on earth are we going to know who is ill? How are we going to keep track of where the ill are? Testing in hospitals is just the start.
It means as soon as we identify somebody we know is positive, we can remove them from the hospital, make them safe, and means that they're not going to spread the disease. And we're just going to have to try to use a tiered method whereby we take sensible decisions. We have to get back to work eventually because the economy needs it. We all know that.
And according to a new poll, there's widespread support for government tracking of those diagnosed with coronavirus using mobile phone data. A government following the every move of its people, something that not long ago was unthinkable. But these are unprecedented times.
Now, an early release program in prisons has been abandoned after 6 offenders were freed by mistake. The programme was designed to ease pressure on prisons during the pandemic, but it's now been suspended, although all the offenders are back in jail now, as our Home Affairs correspondent Simon Israel reports.
HMP Sudbury in the Midlands was one of 3 prisons where, according to the Ministry of Justice, an administrative error occurred. It amounted to some prisoners already released under licence being advised they don't have to return to jail, and then being told the opposite. The partner of one drove him back herself when informed of the mistake. In a statement to Channel 4 News, the MOJ said, "The men were released too early, but were otherwise eligible under the scheme and returned compliantly to prison when asked to do so. We have strengthened the administrative processes around the scheme to make sure this does not happen again."
The Secretary of State has announced a programme of release, which in itself is so cautious to be almost meaningless, which hasn't even started, and to suspend it because 6 people were released by mistake and subsequently returned compliantly is such cowardice. I think it's putting the public at risk because prisons are dangerous places. People are getting sick in them. Staff are getting sick, prisoners are getting sick, and families will be really worried.
On Tuesday, the Justice Select Committee were told that hundreds of low-risk offenders will be let out this week, as the Justice Secretary Robert Buckland's plan to free up 4,000 prisoners finally got underway.
We released 4 men last week and are planning to release a significant number this week. We have been, over the last few days, conducting the absolutely necessary checks to ensure that the people that we will be releasing early do not pose a risk to the public.
But the mistake has put that on hold. Channel 4 News has learnt that plans to release a number serving time at Ford Open Prison was cancelled 5 hours later. The wife of one told me she's devastated and fears the prison service will miss the boat in stopping the virus spreading by the time ministers get their act together.
The government's got to move very quickly to reopen the scheme, to get social distancing happening in our prisons. We've got thousands of prisoners in our country sitting 2 to a cell. That is dangerous. We've had prison staff die, and we've had prisoners die in these last few weeks. The general view is that prisons are about 2 weeks behind the national picture. So as we're seeing in care homes, we could see a crisis in prisons in the coming days and weeks.
So far, there has not been an explosion in COVID-19 cases behind bars that was feared. But more than half the prisons in England and Wales now have coronavirus cases. Latest figures from the Ministry of Justice show that 255 prisoners have contracted COVID-19 in 62 prisons, and 138 prison staff now have the virus across 49 jails. But it's by no means over. While the early release scheme has been put on hold at least until next week, containing the virus may involve having to transfer prisoners from an infected jail to one which has less cases or none at all. And that's another major problem for the government.
Simon Israel reporting, but back to the main news today. Gowns, aprons, masks and other personal protective equipment are the first line of defence for many health workers dealing with COVID-19 patients. Concern about the lack of supply has led to the government advising people to reuse PPE in cases. But some doctors and members of the public have taken matters into their own hands by buying them independently and giving them to hospitals. Inigo Gilmore reports.
We've been here many times before since the crisis began, and this weekend, once again, the recurring problem of shortages of personal protective equipment for frontline staff. And now doctors and nurses are being asked to work without protective full-length gowns when treating COVID patients. Speaking to a committee of MPs online, the Health Secretary, Matt Hancock, was asked when healthcare workers would receive adequate PPE.
The answer to that is as soon as possible. And I wish I could wave a magic wand, but I can't.
His comments have coincided with a significant U-turn and new advice from Public Health England, who've told frontline staff to use flimsy plastic aprons when gowns ran out, even though doctors and nurses fear this may lead to more of them contracting the virus and putting lives at risk. Last night, the government changed its guidance on the possibility of reusing some PPE in certain situations. Public Health England said the HSE recognises that some compromise is needed to optimise the supply of PPE in times of extreme shortages. These are exceptional circumstances and do not reflect HSE's standard approach. It should also recognise that certain equipment, for example gloves and aprons, cannot be reused. Union representatives say the downgrading of PPE is a betrayal of frontline workers who are already facing great risks.
The fact that the guidance has only changed within a week, and it seems very clear the guidance is being changed according to the supply needs and not according to the safety of the healthcare workers, and that's inappropriate.
This is how some doctors are responding. A volunteer network called Med Supply Drive UK now collects and delivers donated PPE to hospitals and clinics. Here, a box of full-length protective suits is being taken to a London hospital. Dr. Amy Clifford told me she had ordered the suits from China and paid for them with her own money.
Having read, in the news and on social media that there is a severe lack of equipment, so things even like aprons being recommended when actually that's not adequate PPE. But it was also good timing as well that we put in the order, I think probably about a week or so ago, and they turned up yesterday.
She was concerned that downgrading PPE was exposing frontline staff to grave risk.
I think the government have a duty to protect healthcare workers. You cannot ask someone to expose themselves to conditions where potentially they may die as a result. And I think it's putting doctors and nurses and healthcare professionals in a very difficult position.
Today, the National Medical Director of NHS England said he's sympathised with his colleagues.
And I can absolutely assure you that for me and my clinical colleagues, this is very personal. These are my friends, these are my colleagues, these are some of my extended family.
The government said that tomorrow 84 tonnes of PPE will arrive from Turkey, perhaps plugging the gap, for now at least.
Well, joining me now to discuss the question of how long we need to keep social distancing and when we might see widespread immunity in the population are Dick Sibley, Professor of Veterinary Science from Studley in Devon, and Dr. Zania Stamataki, who's an immunologist at the University of Birmingham. Dick Sibley, you've co-authored a paper about the lessons in animal health. Now, as I understand it, are you arguing that we should sort of divide the public into the young and healthy who can start getting back to sort of normality and the more vulnerable who can't?
Not quite. I'm coming from this angle from somebody who has had experience in the veterinary world of dealing with similar outbreaks of disease locally, nationally, internationally. We lived through a foot and mouth outbreak, and there's unfortunate similarities of how this is being handled. What I see at the moment is a group of well-intentioned people, but they're acting like rabbits in the headlights, and at some point you have to get out of the car and either shoo them away or run them over. So there needs to be some planning and some decision making here as to how we're going to get out of this. Now, what we did was looked at this from if this was an animal outbreak of disease, it's not abnormal in that you always get a spectrum of clinical effects from those that are exposed to the virus and don't have any clinical outcomes, right to those that react badly and die. The exceptionalism of this virus is that this spectrum is hugely wide. But at the one end, it's fairly consistent that we have about, just as Neil Ferguson predicted, about 5% of infections end up in hospital, about a third of those go on to ICU, and about half of those then die. That's been consistent right through the outbreak. But what it means is that there's been probably another 95,000. So each day there's about 5,000 people testing positive in hospitals. That means that there's about 100,000 out there that have caught the disease and got over it. Now, what we need to do is identify those that are going to be clinically affected before they are and protect them, and allow those that are going to be resilient to this disease to basically carry on with their normal lives at a controlled rate of exposure.
So you are arguing for sort of a controlled herd immunity?
That's going to be inevitable until we get a vaccine.
Okay.
Because this virus is going to keep circulating. Whatever we do, as soon as we go out to play, the virus is going to come out to play with us.
Let me talk to Dr. Stamataki. I mean, this is sort of the nub of the argument, isn't it? That is herd immunity inevitable because a vaccine is too difficult and too far away? Or is there another way of living and trying to resume some sort of normal life?
It would be fantastic if I could tell you that we can develop herd immunity to this infection. But at the moment, the data is just not there to tell us whether those that recover from the infection develop immunological memory at all. Immunological memory is when we have become infected with a pathogen, and then the next time that we become infected with the same pathogen, our body remembers, and it mounts an immune response that protects us without having severe symptoms. We don't know that this is the case yet for the SARS coronavirus 2 that causes the COVID-19. It's too early to tell.
So what does that mean? Does that mean, we've just got to stay living like this indefinitely?
I realize from an economic perspective this is inappropriate, but from an immunology perspective, we can't even predict who is going to develop severe symptoms from this infection. What we need to do is we need to think about infrastructural contingencies, and we need to have personal changes in our lifestyle as well that are going to allow us to minimize exposure, because we can't predict who is going to be severely affected. We know over the past few months that some very young people that had no underlying conditions have died from this infection. It's more rare compared to the elderly, but still we know that this is the case.
So let me just ask you about some practical things then, which is what people want to know. The schools, should schools even think about going back before September?
Probably not. We are starting now to see the impact of the shutdown for virus transmission. The impact has not become clear yet, and we wanted to see what the implications are for school closures. We don't really understand whether that has helped or not. But from a practical perspective, the exposure of parents as well to other people at the drop-off and children as carriers, we don't really understand what are the correlates of their protection.
I see you shaking your head at a lot of this.
There just isn't the data. The data is not there to tell us whether we are safe to reopen schools.
Let's just hear from Dick Sibley on this.
Sometimes we have to follow a hunch. And often in my world, we wait for the science to catch up, and waiting for the science to give us answers. Back in the days of BSE, in fact, they're still studying some of the transmission methods of BSE when we eradicated the disease 5 years ago based on a hunch. So sometimes we have to go with what we believe. This would be a very unusual coronavirus if it did not raise an immune response and create immunity. Every other coronavirus that we deal with, you get fairly strong immunity over the short term. Okay, it's not long term, but you can get re-exposure to the virus. Virus will boost immunity. We have to somehow find a middle ground between what is perceived to be a conflict between economic resolution and saving lives. And it's unfortunate this argument has become bipolar, because it needn't be.
But your solution does suggest hundreds of thousands of deaths, doesn't it? Because if you're saying 60% of the population should just get it, if 1% of them die, then that's a lot of people.
No, because I think we can predict who those people are that are going to end up in hospital and succumb to the disease. Not totally, but we've got a fairly good idea who they are. They're mostly the aged, they're mostly people with comorbidities, the diabetics, the immunosuppressed. We know these people, and we should protect them. I think it's scandalous that we've allowed this disease to get into the care homes and into the prisons. Have the medics not heard of biosecurity, how to keep disease out? Every farm that I go to has a biosecurity plan to keep disease out. We're well versed in it.
All right.
I'm not allowed on farms unless I follow certain biosecurity protocols.
Well, I'd love to come back and talk about this more, but for now we're out of time. Thank you both very much indeed for joining us tonight. Now, every Thursday night, we step outside to applaud the NHS workers who are caring for our loved ones and battling to save lives. But there are other key workers, of course, too, who keep the country running. Refuse collectors, supermarket workers, delivery drivers, care assistants, who turn up at work every day so the rest of us can stay at home. Well, Minnie Stevenson has been hearing the stories of those who are working through the pandemic.
Up at 5 a.m. and on to the front line. A forgotten front line, argue some. Key workers, bin men and women across the UK. The hours are long, the work risky during COVID-19, but essential. We're in West London where we meet Sean.
Sean, you're right in the thick of it here. Do you ever get scared?
No, not really. It is worrying at this moment in time. You just have to carry on. When you look at the NHS staff working, this is easy really, you know.
Sean's been a refuse worker for nearly 20 years. There's no doubt in his mind that here is where he needs to be.
Are your family worried though when you come out to work?
Yeah, my wife is extremely. Yeah. She's worried that I'll contract it, I'll get the virus.
Hannah finds herself on the front line too, as an Asda worker in Stockton-on-Tees, County Durham. She's been volunteering for extra shifts so others don't have to. And organising the occasional dance-off to lift everyone's spirits.
The situation of key workers, there's still very much a hierarchy almost in that. But I think that's mainly down to how the government portrays it in terms of the way that they've organised, how they want to put out the PPE, for example, and the trickle-down effect that kind of ultimately has upon us all.
I mean, Christina, next we meet Christina. Originally from Romania, Christina is a healthcare assistant at a hospital, coming into contact with coronavirus patients. NHS workers who have died during this crisis are understandably on her mind.
Even though I'm hearing everywhere, news, newspaper, people in the trains, patients talking about it, I'm trying just to be positive and keep on going, and hopefully it's going to go very soon.
It must have an impact though.
It does. It does. I'm a bit scared, but I'm trying not to let everyone see it.
And what kind of reaction have you had from people? Because we've seen people clapping for key workers across the country. What's that been like?
Oh my gosh, it was like goosebumps, and it made me cry, to be honest, because I thought that I'm a part of it, full of joy and happiness, and making me feel that I'm needed in NHS.
Needed and now wanting to become a nurse. The trade union who represent Christina and thousands, GMB, say while there are positives, the pandemic has also highlighted an uncomfortable truth. Millions of workers across the UK simply weren't getting the recognition they deserve. When this is over, they hope cleaners, care workers and bin collectors get the rewards and respect they're now starting to see.
We've seen thank you notes going up on bins across the country. What's that like for you to see that?
Oh, it's nice. It's nice to have a bit of recognition. We never previously had it. Clapping, that sort of thing, leaving out chocolate, stuff like that. Very nice gestures.
At the end of the day, you go home and you're feeling very satisfied of what you've done and what you've accomplished that day, just by arranging a small pillow and by making them laugh a bit.
Now, having to do with childbirth in normal times is worrying enough, but now women are having to plan having babies while hospitals are removing services they normally offer because of ambulance and staff shortages. Some are so worried about infection, they're even looking into giving birth by themselves at home. Aisha Tull reports.
Guess who has made an arrival?
The rules around having a baby are changing. Home births are being drastically reduced to free up ambulances that may be called, and midwife staff shortages are causing some birth centres to close. Marwa gave birth to her fourth child, Asha, just a couple of weeks ago.
I wasn't able to have any visitors come to the hospital, and the major thing for me was that my partner couldn't actually stay with me during labour, which was a big thing for me, because during that time you're so vulnerable, you're in the most pain that you'll ever be in your life, and knowing that your partner can't be there to support you is quite frightening, to be honest with you.
In most cases, delivering a baby during the coronavirus pandemic is safe. But earlier this week, Channel 4 News learned of a tragic case. Heavily pregnant 28-year-old nurse Mary Agiwa Agepong died after testing positive for COVID-19. She had an emergency C-section to deliver and save her baby daughter. The little girl is understood to be doing well. Jess is having a baby in a few weeks' time. She had planned a home birth, but that's been cancelled.
Frankly, the fear of going into a hospital at what will probably be the peak of this crisis, and the fact that it feels very unnatural to me in my guts, like I'm a healthy person, hopefully my baby is healthy, the idea of taking it into the health service at this time feels very much against my instincts. But the other thing is the grief that I think a lot of pregnant women are feeling about the pregnancy, the birth that they were meant to have.
Jess isn't alone. Maternity rights groups say that a number of women are looking at free birthing. That's delivering your baby all by yourself. Charlie is a doula who supports women through pregnancy. She says 50% of her clients have asked about it.
I worry a little bit that women are making sort of knee-jerk decisions from a place of fear rather than active, informed decisions that are the right outcome for them.
Pregnant women across the country may find that their birthing options are changing, but the groups who are overseeing delivering babies in this country say the best thing you can do is check with your local service. And they also tell me that they're fighting really hard to make sure that a woman has at least one birthing partner with them.
There's a lot of anxiety, there's a lot of confusion as well as to what's happening with guidelines changing all of the time. And us hearing constant updates as to situations changing and new measures being brought into place. So I think that it's really, really important that during this anxious time, we focus on the positives and we focus on those things that you can control.
We're reaching the arms out.
Mums-to-be across the UK are finding new ways to cope, with online baby yoga classes, midwives just a video call away, and WhatsApp groups pinging with information. Health officials say they're working their hardest to make sure birth is as safe as it can be.